We're going to get started now. For everyone who doesn't know me, my name is Derek Donaldson. I'm the HR supervisor here with Donnelly-Boland and Associates. We also have Dan and Kirsten here from Liberty Insurance. You guys probably recognize them as they do our presentation every year. We also have Kevin Bowen, one of the trustees of our plan, who's going to be talking a little bit about some of the changes and some of the reasoning behind the changes that we've made for this open enrollment. So I'm going to start the meeting off by just reviewing the annual open enrollment form that we have everybody do each year, and then we'll move on from there. Before I get into that, though, I just want to remind everyone, if you don't have your full name up in the Zoom name there in your box, please update that so we can keep track of the attendance for today's meeting. Okay, so we are going to get going here. Everyone, this is the annual open enrollment form here. Should look pretty familiar to everyone as it hasn't changed for a few years now. The section 1 here is just confirming your current benefits. Everyone should be completing this section regardless of whether you're making changes or not. One of the main things that's going to stick out to you here is the medical coverage. The MyCare 1000 and the MyCare 3500 now say /EPO 1500 or 3500. And that is just relating to 2 plan changes that we're making for this year. And Dan's going to elaborate on that during his presentation. So everyone will need to complete this medical, dental, vision, short and long-term disability, and voluntary life, confirming all of your current coverages. And then section 2 is for anything benefits that are changing. So if you're not making any changes, all you need to do is check the box for please keep all my benefits the same. If you want to make any changes to anything, you would check the box for that plan that you want to change, and then you would submit that corresponding enrollment form along with it. Now, this form here, the open enrollment form, just like in previous years, will be sent out through DocuSign. So we're hoping to get that out probably later this week, early next week at the latest, for everyone to complete. Also, everything that we're reviewing here today, the open enrollment form, the PDFs that Dan's going to be reviewing, as well as this PowerPoint, rate grids, anything that we go over in today's meeting is going to be emailed out to everyone so you have a copy of it for reference. Down at the bottom, again, this will be through DocuSign, so you'll be signing this electronically, and then all forms are due back to the HR department by March 25th. That's just to give us enough time to review everything and make all the changes there for April 1st. If you're not sure on anything with the form or you're not sure of your current coverages, it can be found in Vista. If you can't find it in Vista, reach out to anybody in the HR department and we can answer any questions that you may have. So with that, I'll get rid of that form. And then we will turn it over to Dan here. I'll reshare my screen for some of the PDFs that he's going to review for some of the benefits of UPMC.
Very good. Thank you, Derek. And I just want to emphasize to everybody that if you do not want to make any changes, you'll see that there is a box that you can check at the bottom of that form, but Derek still wants that form returned, and it's going to be done via right signature or DocuSign electronically. So you still will have to complete that form, regardless if you feel like you're not making a change or not. Okay. And with that being said, I want to say thank you very much again for Donnelly-Boland and Associates, their leadership team, for allowing Kirsten and I to present an overview of your employee benefit package. It is a little bit complicated because there are a few moving parts, but it really is designed in such a way that it is a very, very rich benefit package. So please make sure you pay attention. I believe Derek is recording this, so it will be posted to your site. If you have any questions, you can look at it in the future. We're probably going to have another learning session a few months down the road, just as a, to again, repeat the information and have a Q&A for folks that maybe don't understand something. But it's a great benefit package, very rich. So thank you for Donnelly-Boland and Associates for allowing us to come on into your virtual world and present it to you. And with that being said, I'm going to go ahead and get started. You have 4 health plans to choose from. All 4 are UPMC health plan options. All 4 plans come with a value-added benefit. Actually, there's 3 of them: Anywhere Care, Assist America, and an EAP solution program. So the first one that Derek pulled up here is the Anywhere Care. Anywhere Care is a global concierge travel assistance program. If you're going to be traveling and you have some questions prior to your travel, you can contact Anywhere Care. They can help you. If you are traveling, you're more than 100 miles from Western PA, and you have a medical situation or even a non-medical situation, such as maybe you were robbed and all your documents and passports and ID is all stolen, you can get a hold of Anywhere Care, and these folks can help you. They have translators around the globe. So depending on where you're traveling, if something happens, it's an emergency medical situation, you're not speaking the language, they can help you. I have a client a few years ago in Mexico, supposed to leave on Saturday. They were there Saturday to Saturday. Well, Friday afternoon, his wife has a stroke. Everybody is speaking Spanish. He doesn't understand what they're saying, but they take her to a hospital. The only thing he understood was Visa and MasterCard. He called me. I told him to reach out to Assist America. Assist America stepped in, provide translators for him, took care of the medical bills while he was there. They actually had to stay an extra week, and they arranged for travel when she was stable to come back to the US. So it's a great benefit. They have their own app. Please make sure you take the time to read the brochure, download their app, upmcanywherecare.com, and go from there. And I think I just messed it up, Derek. I apologize. So I have to rewind that, everybody. I apologize. Of course, Derek is recording this one. What I just described, would you pull up the Assist America brochure, Derek, please? Thank you. I apologize, everybody. There we go. That's it. No, my mistake. What I just described was the Assist America program. Assist America is the travel concierge global program. Okay, your membership in UPMC Health Plan entitles you to a unique global emergency services program called Assist America. Key services on the right-hand side: medical consultation, evaluation, referrals, hospital admission assistance, emergency medical evacuation, medical repatriation. It's a great program. It is not a medical insurance program, but they are partnered with UPMC. They are a global travel concierge service. So they do have their own app. Make sure you read the brochure, download their app, become familiar with it. So if you are going to travel, especially out of the country, and have questions, you'd want to speak to Assist America ahead of time. If you are traveling and you do have a situation, like I said, something is stolen, maybe you're hospitalized, they don't accept UPMC, you're not sure what to do, please contact these folks at Assist America. They are there to help you. It's included with all 4 plans from UPMC. Okay. Next slide, please, Derek. I think is Anywhere Care. Thank you. I apologize. Sorry again, everybody. Anywhere Care. This is your virtual care from UPMC. Right there, the first paragraph. If you have non-emergency, non-urgent symptoms, UPMC Anywhere Care lets you have a face-to-face conversation with a UPMC provider via live video on your mobile device, tablet, or computer. It's your virtual visit program. And then you see on the right-hand side, can I use UPMC Anywhere Care anytime, day or night? Yes. You can access UPMC Anywhere Care 24/7, 365 days a year. And you want to make sure you register at upmcanywherecare.com. Very similar to going to a new physician for the first time. They're going to want some personal information about you, height, weight, some history. Are you taking any medications? Are you allergic to any medications? Things of that nature. So do not wait until you need to use it to register. Take the time, register with Anywhere Care after April 1st. If you're an existing employee and you're enrolled on the health plan, you should have this registered already. If not, please take the time to do so that if you need to use the virtual care, it'll be a simple process for you, and hopefully get you the care that you need. Again, this is for non-urgent emergency services, rashes, bad cold, urinary tract infections, things along those lines. There's a lot of things that they can treat via virtual medicine these days. So please make sure you remember that you have this benefit. Again, it's included with any of the 4 UPMC health plans you select. And then the next slide should be the UPMC Life Solutions. This is an employee assistance program. It's free, it's confidential, it's for you and anyone living under your roof, whether they're enrolled in the plan or not. Any dependents up to age 26, if they're living with you. Life Solutions is an employee assistance program, and it's offered through UPMC's Work Partners affiliate. It's there to help you with counseling. Maybe you have stress. This COVID-19 is doing a lot of things to, causing a lot of angst with a lot of people. Maybe you've lost a loved one, stress with, trying to quit smoking or drinking or cut back on things. But it is a private session, 24/7 telephonic access and support. There's no fee, no copay. It's separate from the health plan. It's not connected to the health plan. And it again, very confidential. You can visit them at lifesolutionsforyou.com. There's a lot of resources there. All three of these programs, all three of these value-added benefits are included with each and every UPMC health plan. So please remember you have these additional benefits at your disposal. Thank you, Derek.
All right. And then I will switch this over to the PowerPoint here.
Okay.
Just to let everybody know, if you have any questions throughout the presentation here, feel free to put them in the chat box. We'll monitor the chat box as we go here and answer any questions as they come up, or you could always feel free to unmute yourself and ask any questions as well.
Okay, thank you, Derek. Again, Donnelly-Boland and Associates, delivering quality, commitment, and value. This is your open enrollment for 2022, presented by myself, Dan DeStefano, and the Liberty Insurance Agency. Your 2022 open enrollment will be from March 8th through March 23rd. We're going to cover the topics on medical, dental, vision, life, and disability. Your enrollment must be submitted to the HR department no later than March 25th. Your plan starts April 1st. So the new plan year starts April 1st. The benefit elections you make during open enrollment will be in effect for the entire plan year. The plan runs from April 1st to March 31st. You cannot make changes to your benefit selections during the year unless you have a qualified status change. In insurance terms, we're looking at things such as marriage, divorce, birth or adoption of a child, death, loss of other coverage, or employment status change. If you experience a qualified event, please notify Human Resources within 30 days if you wish to make any changes. Medical plans. As I mentioned, we have 4 medical plans to offer you from UPMC. Again, it's a little bit of a comprehensive design package, but it's very, very rich in benefits for sure. The following 4 plans will be offered. We have a Healthy You PPO 1250. That's what's in place right now. We have a Healthy You PPO 2000. That's also in place right now. And the 2 MyCare plans are going away. We are offering an EPO 1500 utilizing the partner network. And we have an EPO 3500 plan utilizing the partner network. What is the partner network? For residents of Allegheny, Bedford, Blair, Clinton, Erie, Lawrence, Lycoming, Mercer, Somerset, Tioga, and Venango counties only. This network includes all UPMC providers. So let me just talk about this for a second. The Healthy You plans give you access to the UPMC Premium Network, which includes everything UPMC owns, as well as access to their contracted independent providers, such as Jefferson Hospital, Excella Health, St. Clair Hospital, Cleveland Clinic, Heritage Valley. Those are all partners with UPMC. And with the Healthy You product, you have access to all those providers. The EPO 1500 and 3500, they utilize the partner network only and exclusively, which means you have to seek care from a UPMC facility. So it is something that is owned by UPMC. Obviously, they have a great deal of hospitals that they own, about 4,000 physician practices that they own. And before we made this decision, just to let everybody know this, we looked at the claims. We don't see claims by individuals. We see claims in an aggregate. 98% of your claims of your entire population are being performed by partner network providers. So we don't feel like this is going to cause an issue for anybody, but the MyCare Advantage plans are going away, being replaced by the partner network plan. So it shouldn't cause any stress to anybody. In the event of emergency, you can seek care from any emergency department, even if the hospital is not in the partner network. The emergency care you will receive will be covered as at the in-network level. Okay, and I hope that makes sense to everybody. If you have questions, as Derek mentioned, please feel free to use the chat. I think one popped up right now. I'm gonna take a look at it, Derek. Who can see your messages? Recording on. Is there a
No,
question?
there's nothing. No,
Okay.
no questions.
Okay, very good. Thanks, Derek. I'll let you take control of that. All right, so
No
let's look at the two plans here. The Healthy You PPO 1250, the Healthy You PPO 2000. As you might expect, the 1250 plan has a $1,250 deductible. The $2,000 deductible plan has a $2,000 deductible. Twice that amount for the family maximum. The plan pays 90% of eligible charges after the deductible. 90% after deductible is paid by UPMC, which means you owe 10%. Your out-of-pocket maximum for a single for the 1250 plan is $2,500. So you have a $1,250 deductible, and then you would owe an additional 10% of eligible charges up to an additional $1,250, where your total out-of-pocket is $2,500. So a very rich plan. A very rich plan for sure. If you look to the right, the Healthy You 2000, $2,000 deductible, 90% after deductible, which means you pay 10%. You pay 10% up to a total of $4,000 out of pocket. Your preventive care is covered at 100%. All your preventive care, if coded properly, is covered at 100%. If you go to UPMC's website, and you all should be registered at upmchealthplan.com, you can change your address, order extra ID cards, look at your claims 24/7. So you all should be registered with UPMC Health Plan. And also, they will be able to send you information that can help you with promotions and discounts and whatnot. So please make sure you're registered. You can look at all the items they have coded as preventive care, and there's about 80 items that they deem to be preventive in nature. All the immunizations for the children's, your adult physicals, the OBGYNs, the mammograms, colonoscopies over age 50, flu vaccines and shingles vaccines. There's just, a plethora of list of items that are eligible. And again, if coded properly, are covered 100% without a copay and a deductible. Just a quick example note. Perhaps you had a heart attack a few years ago and you say, hey, Dan, I go see my cardiologist once a year for a checkup. Why am I being charged a copay, or why do I have to pay for that? Because your primary care physician is the one that performs the annual wellness visit. It's great that you see your cardiologist yearly, as you should, but your annual routine examination is provided by your PCP, family physician. Okay. Preventive care, again, 100% coverage. Everything else, if you look down below, your office visit copay, specialist, telemedicine, urgent care, emergency room, hospital inpatient, outpatient, x-ray lab work, it's all covered 90% after deductible. The deductible is $1,250 on the one plan, $2,000 on the other. And again, you do have an out-of-pocket limit. So in the first plan, the $1,250, let's suppose the claim was $100,000. You would only owe $2,500. If it was $500,000, you would only owe $2,500. So you are protected. They have a drug program. It is after the deductible. Most you pay for prescriptions is $8 for generic, $38 for preferred brand, $76 for non-preferred brand, and $76 for specialty medications. They do have a mail order program. You can pay for 2 months and you get the third month free. The plans also have an out-of-network benefit. So if you wanted to go to a physician, a hospital out of state, maybe Alabama, to have knee surgery for some reason, they would apply the deductible of $1,250 in the first plan. They would pay 70%, which means you'd have to pay 30%. But again, emergencies are covered at the in-network level. Over 98% of the population is utilizing UPMC providers, so I don't expect that's going to be an issue with anybody. Now, you'll notice these plans are called Healthy U plans, and they're called Healthy U for a reason. These two plans have a rider, if you would, associated with them. These two plans allow each adult member to earn up to $500 that is accounted for and kept by UPMC. You can earn up to $500 as an adult member to offset your deductible. So, and how do you earn that money? Well, if you go onto their website and you look up a Healthy U program, they'll give you a lot of information. There's a lot of different ways, but examples are: get your adult physical, get your teeth cleaned, get your vision examination, sign up for a stress management class, sign up for a healthy eating class. I know in years past when I've done these presentations in person, I've had many employees tell me, Dan, I was able to get all my money, my $500 accumulated in less than 2 weeks. Great. So it's pretty easy to earn your $500, but that money is housed and kept on record by UPMC so that if you did earn the $500 and you did go see a doctor, they would pay the doctor out of your $500 healthy incentive account. Again, that is kept by UPMC. And that's another reason you should log on to upmchealthplan.com to make sure you can see the information and make sure that your credits are being applied. Okay. Again, it's a great program, very rich design. You can earn up to $500 as an adult member. So you as the employee can earn $500, your spouse can earn $500. If you enroll in family coverage, unfortunately, the children cannot earn any credits. And repeating myself one more time, that money is housed and credited and maintained by UPMC. Any questions on the Healthy U plans?
And can you talk a little bit about, we had a question come in about the difference between here, the deductible at the top, out-of-pocket maximum, and then down at the bottom, that out-of-pocket limit.
Okay, great. The deductible up the top is your deductible if you're utilizing a UPMC provider or an affiliated contracted provider. Down below, if you want to go to an out-of-network provider, that also has a $1,250 deductible. However, they are not two separate deductibles. They are not two separate deductibles. UPMC combines them. So you only have one deductible of $1,250. The difference is if you stay in network, the plan pays 90%. And your limit exposure is $2,500. If you go out of the network for a non-emergency situation, again, you heard Dr. Derrick in Alabama is the best knee surgeon, and you want to go Dr. Derrick in Alabama, you're going to have a $1,250 deductible. Maybe you've met it already, maybe you haven't. You have a $1,250 deductible, and then UPMC will pay 70% of eligible charges. You'll be responsible for 30%. And if you scroll down just a teeny bit further, Derrick, please. Oh, not that far. The co-insurance is 70%, which means you pay 30%, but your out-of-pocket limit is $10,000 on that if you go out of network on a voluntary basis. Does that help? Does that clear things up for everybody?
Yeah, I think that helped, Dan. But another question come through, and yes, a spouse can earn the Healthy U credits as well. No children, yes, like Dan said, but you and your spouse could both earn that $500 credit. We had one other question come in about prescriptions. Okay. So prescriptions would be, you would pay 100% of your prescriptions until you hit your deductible. Once you hit your deductible, then it turns into the $8 for generic, that price there. But if you do earn those Healthy You money, that's automatically deducted from those costs as well. So one thing to keep in mind there.
That's correct. That's a great explanation, Derek. That's perfect, actually. And just to throw something else at somebody, I know you see a lot being advertised now, Good RX. And so it's a prescription discount program with coupons. Sometime if you enroll in this plan and you need to take a prescription and perhaps you haven't earned your $500, the credit to pay for the prescription, if it's a little bit expensive, if you look at a Good RX, maybe there is a coupon for you. But keep in mind, if you use the Good RX coupon, that payment you make for the prescription will not count against your $1,250. I have a plan very similar to this. I needed a prescription, a steroid for my eye. The steroid was $190 under my health plan. I checked Good RX. I got it for $23. So I paid the $23, but that $23 is not counting against my deductible. But I chose to pay $23 as opposed to $190. Okay. So if that, just to keep that in the back of your mind, everybody. Any other questions about the Healthy You plans? This is good. We got a lot of interaction today.
Nothing else in the chat right now, but if anything comes through, I'll bring it up.
Okay, very good. Thank you. Okay, here are your partner plan options. We have an EPO 1500 and an EPO 3500. As the name would indicate, the $1,500 plan has a $1,500 deductible. The $3,500 plan has a $3,500 deductible. Maximum of twice that amount for the family exposure. Coinsurance, this plan pays, or these plans pay 100% after deductible. The maximum out of pocket is $81.50 for an individual or twice that amount for a family. And before you get too excited, I can't imagine how you would reach your out-of-pocket maximum. In the first plan, the deductible is $1,500. The coinsurance is 100% after deductible. So it would be virtually impossible to get to $81.50. Your preventive care is covered 100% in either plan. Office copays, $20 and $40 for specialists. On the $3,500 plan, it's slightly higher, $30 and $60. Your urgent care through telemedicine, this is your anywhere care. Urgent care is $5, a PCP is $10, specialist is $20. Urgent care is $75 on both plans. Emergency room is $150 on both plans. It's waived if you're admitted. Hospital inpatient, outpatient, X-ray lab work, all covered 100% after deductible. This also has a prescription drug program. The most you pay for generic, day one, it's live for you. The most you pay for prescriptions on day one is $12 for generic, $38 for preferred brand, $76 for non-preferred brand, and $76 for specialty medications. You can get the 3-month supply. You pay for 2 months, you get the 3rd month for free. So you might be thinking, how do I get to the out-of-pocket maximum, Dan? Well, the only way you can get there is your deductible is included, plus all of your copays. So perhaps you're seeing a specialist once a week. Perhaps you're going to the emergency room every week. Perhaps you're taking a lot of medications. I don't know how anyone could get to $81.50, truthfully. But that's the way the plan is written and the plan is designed. But nonetheless, it's there for you to protect you. On the $3,500 plan, your $3,500 deductible goes towards your out-of-pocket maximum. And again, all the copays associated with the plan go into we'll call a cumulative bucket, if you would. And if that bucket should ever reach $81.50, then the plan pays 100% of everything. The partner network is for Allegheny County residents only, as well as those other outlying areas we talked about and I mentioned earlier. But I know most of the folks are living in Allegheny County. The partner network is available to you. This limits you to UPMC only facilities. So you want to check the website. If it's UPMC, they're in the partner network. So all their hospitals they own, all the physician practices they own are in the network. And one thing I'd like to bring to everybody's attention, you'll see in the middle there, urgent care, $75 copay. I do mean urgent care. MedExpress is not included. Urgent care is owned by UPMC and has the purple insignia. Sometimes we run into issues. It's interesting in the Monroeville area. We have the UPMC hospital. We have Forbes Hospital. We have a MedExpress and we have an urgent care. They're all within a quarter mile of one another, so to speak. But you want to make sure you are utilizing urgent care from UPMC. I see the chat question just came in from Roseanne, and she said she's in Butler County. So Butler County is not eligible for the partner network program. You're welcome, Roseanne. Okay. Any other questions before I talk about the dental plan? That's an interesting question from Samuel Grant, asking if additional counties will be added. Additional counties would be added if UPMC builds additional facilities in those outlying areas. If they do not build additional facilities in those outlying areas, then those counties most likely will not be added. Okay, any other questions? Again, what's great about Donnelly-Boland and Associates, it's a very comprehensive, it's a very rich benefit package, and you have 4 plans to choose from, which is really, really nice. You have 4 plans to choose from. Most firms offer you 1, maybe 2 plans, but you have 4 plans to pick from. We're going to go through the math exercise a little bit later, but they are very, very reasonably priced, extremely affordable. The leadership team made a lot of changes this year. I think a lot of people are going to be pleasantly surprised when they see how this rolls out and what the cost is, or no cost, I should say, to participate in these plans. So it's really, really pretty awesome.